Hey guys, and welcome back to XO Medical Spa. Thank you for joining in again, and hopefully you guys liked the previous episode. And for that gift and giving it a thumbs up, here's a bottle of Dysport. Now that we've all enjoyed that gift of Botox and that gift of Dysport picture that I sent you guys, today we're going to talk about PDO threads again, everyone's favorite subject, and we're going to talk about more specifically what the PDO threads are and what varieties do we use here in office and how we use them a little bit as well. But I really want to dive into the parts of which threads we use specifically because that's a common question we get. Now check our previous episode, I'll link it up here, on what PDO threads actually are. But for us PLLA docs who know our PDO, we use Novathreads. We use probably one or two different other brands, but predominantly we use Novathreads here in office. Now among those threads, we use Barbs, we use molded, we use smooths, and then we use twists. So those are the four main types of threads that we use. Let's discuss why we use each one of them. With PDO threads, we're trying to accomplish two things. We're trying to lift tissue, lift face, neck, chest, any parts of the body, eyebrows, and then more importantly, the way I train on it, the way I treat people, and what's so important to me is how do I build a better tissue quality and build collagen so your face looks tighter and better in the future as well. So for the lifting aspect, we use Barbs and we use molded. Every single thread is monofilament. What does that mean? It means that it just comes from a solid piece of material. And then with that monofilament, we can make different types of threads. With the Barbs and the moldeds, they come in different sizes depending on the manufacturer and depending on the current time of this video. So at the current time of this video, Novathreads has 18 gauge, they have 21 gauge Barbs, and now they developed 18 gauge molded and 19 gauge molded. I think they've developed 21 gauge molded. I'm not sure if they're still out there or not. Don't quote me on that. Either way, 18, 19, 20, and you have Barbs and you have molded. The Barbs and the molded do the actual physical lifting for us. They are elevating, lifting, or approximating tissue to a better position. Both are monofilament, but the differences are Barbs, you take that monofilament and they laser cut little spikies into it. If you can imagine barbed wire, if you can imagine a porcupine tail, if you can imagine those little plants, I think they call them cattails or something like that, but essentially it's just a barb. It looks like a little piece of string with little spikies put on them. I'll put a bigger picture here in the upper corner here. But when I do the procedure, I'll always cut the threads and I'll give that thread to the patient and let them feel it. You'll feel little linear spikes on them. And what that's used for is when I place them into certain places, when I lift the skin up, rather than the skin dropping back down, it catches on those little spikies holding the tissue up. With molded, still a monofilament, but rather than having spikies, which I'll show in the picture up here, they're stacked on top of each other. They're molded. They look more like a Tetris piece than a little linear cut barb, but they're also used for lifting. Now, when I do trainings, I want to make sure a provider or facility is well versed in barbs before I ever move them up to molded. The placement is a little bit different and is less forgiving. Whereas a barb, if I place it wrong, I can generally take it out. Even if I put it in wrong, I can generally take it out. Now with molded, once you place it and you pull out that cannula, for the most part, you're stuck. So you have to be very well versed and really understand how to place threads before I move you up to molded. Now the difference between barb and molded is how much lifting do I want? And then also the other part is it safe and is it the appropriate treatment for a patient? Between 18 gauge, 19, and 21s, that also plays a determining role as well. How thick is the tissue is this patient having? Where am I placing this thread? Can this patient tolerate that much lifting? Is there a chance where I can see lumps and bumps with this? So all those things will determine what barb I use, which molded I use, and which size I use for which patient. So it's very, very important that, again, that provider, that facility is well versed in threads, because there's so many numerous options that you can give a patient. And if you don't understand what to properly give to this patient or do a procedure on this patient, there can be some long-term effects that is not pleasurable for the patient. Now the next thread are the smooths, and these are so underutilized in America. When I listen to patients when they come from another facility and they had the treatment done, or I'll go to trainings and they realize how many threads I put into a patient, it's not because I'm just trying to put in more into a patient for any one reason. I'm trying to give the patient the best procedure possible. So after we've lifted all the skin out of the way, I want to improve the texture of your skin, your wrinkles, your fine lines, your pores, your overall glow. Because if I just lift you and those threads disappear in 6 months, your results disappear in 6 months. But if I have not only lifted you, but if I blanketed the entire surface of your face, neck, chest, brow area with all these tiny little smooth threads, what happens is they act like rebarb. Concrete by itself is very soft and brittle. It takes rebarb inside the concrete to give it structure and rigidity. Because you have all these threads in your face, over the 6 months where the threads are dissolving and you're constantly producing collagen, constantly improving your skin quality, in 6 months when all the threads are gone, you have all this collagen sitting behind. So not only do you look better 6 months later than the moment you met me, more than likely in a year and a half to 2 years when you come back for another treatment of threads, you're likely gonna look even better than 2 years ago when you first met me. However, by laws of aging, you should technically look 2 years older, but more times than not, you don't. And lastly, we have the twists. The twists are similar to smooths. They look like pieces of dental floss, but I'll show a picture up top again. They're coiled. They look like a little slinky. So what happens is when you place these twists and you uncoil them, they open up, they spring open. And what they do is act like a pseudo filler. Threads will never replace volume. So if you need volume, you need fillers. If you need wrinkle reductions, you'll need Botox in certain areas. But everything has a purpose. Rather than overfilling a patient who's very round or a patient who doesn't want a lot of fillers, this is how I complete the treatment. We've lifted with the barbs and molded. We've improved skin quality with the smooths. Finally, I'm taking the twist and I'm putting them into deep folds. Marionette area, deep folds. Nasolabial, deep folds. Glabellar lines, deep folds. So any deep folds, I'm usually putting in. If you've ever seen people with these lateral necklines, or we call them tech neck because we're all on our phones and computer creating this wrinkle, if I put those twists right into those folds, it helps break up the wrinkles because I'm subsizing mechanically trying to break up those wrinkles with that needle. And then the second part is when that twist or that slinky opens up, it gives a filling effect without adding bulk or volume into places we don't want. To review, I usually use PDO Threads here, polyidoxanone. I use Novathreads here, a couple other brands as well, but predominantly Novathreads. Now within Novathreads, you have 3 types: barbs, molded, smooths, and twists. And among certain types, you have 18 gauge, 19 gauge, 21 gauge barbs and molded. Now of the twists and smooths, which I didn't mention, you typically have 27 gauge and 29 gauge. I believe there's one more gauge coming out, but those are the 2 main ones right now and how we use them. So it's not just the lifting aspect. So that's what differentiates us, me as a provider, and how I train versus other facilities. How many threads I put in, where I put them in, and what is the correct proper treatment for you. Because when the threads are gone in 6 months, this is where you'll hear the stuff on Google where it says the results don't last. It's likely the provider didn't do enough of a treatment for you, or didn't give you enough of an education as to why they're doing so much treatment on you. So when you go to other facilities, you get secondary consults, ask what threads are you using, ask how many threads are you using, and then also have them mark on you. You'll really get an understanding as to why we put so many threads here and where I put them versus another facility. So that's a recap of PDO Threads. Again, if you enjoyed that picture of that disc port that I sent you, give it a thumbs up, and if maybe we'll get another gift at next go round. So remember, give it a subscribe, give it a like, and share it to everyone else that you know may be interested in PDO Threads. And drop a comment below in regards to what you want to hear or listen to, or comment on what you think that I've spoken about in PDO Threads today. Let me know what you think.